So, future directions in our practice. I think the biggest thing here is that if not everyone's on board in the practice, you're not going to be able to drive osteoarthritis care. You need everyone on board. You need the receptionists, nurses, and all the vets. Because if everybody is on board and understands the significance of osteoarthritis and weight for their patients, then you're all going to have a concerted effort to, so from the time the client walks in and the owner talks to the receptionist and they say, oh, how are you going with the weight loss? And they get them on the scales and they check them, and there's this kind of push from everybody to think about this. Until you get your staff educated and on board, it's probably not going to be a clear message to the client. So you need to think about that. Client education is the key to kind of ongoing treatment regime. So if you say your dog's got arthritis, you give them a non-steroidal, they go home, 7 days of whatever medication, and the dog looks great, and the owner thinks, this is great, I've done my bit, I've treated the arthritis, and forget that, or haven't really registered that it's an ongoing thing, they're going to come back in 6 months and go say, yeah, it's bad again, didn't work for very long. It's because they need to think about it as a long-term management option. So client education is really important, long-term compliance. And if we do nothing else but improve their weight and forget about all the other treatment, that's going to make a huge difference to them. So improving the weight management of our patients. I'm always surprised how many dogs come into me that are overweight and they didn't really know it. And I'm thinking, but they've seen other people. Surely they would have said to them, maybe they just didn't say it loudly enough. Maybe a specialist saying your dog's overweight means more. I don't know. But it's just such an important thing to get our patients healthier. Interesting statistics. Okay, if you have 1,000 dog patients roughly in your clinic, and most people have at least that, but say you had 1,000 dogs, and we know 20% of them have OA. So 200 patients have osteoarthritis. And if you just wanted to medically manage those osteoarthritis patients, and I know 30 kilos is kind of rough, some of them will be small, some of them are big, whatever. If you just wanted to treat them medically, for instance, and you did a couple of consults a year because you wanted to keep track of how they're going, and I'm just guessing at the prices here, you might charge, I'm just arbitrarily choosing a price. You want to do pre-anaesthetic bloods at least once a year if they're going to have non-steroidals, right? So you want to check their liver and kidney function, make sure we're not damaging those, so we do that maybe once a year. We do a couple of courses of a pentosan polysulfate. We give them a metabolic plus diet for the year. And they have maybe 2 or 3 courses of a non-steroidal. Okay, that's how much that patient is worth to your clinic. Now, I'm not just all about money. Not only are you helping your clinic, you're helping the owner to treat their pet better, and that pet is going to be much happier to have good treatment for their osteoarthritis. So everyone wins, okay? So just think about the statistics. That's one dog. You have maybe 200, or how many cases you have through your clinic. And that's just the dogs. We haven't even talked about the cats. Okay, and that doesn't even cover any anaesthetics, radiographs, advanced imaging, surgery, physio, all of those other things that often go along with treating those dogs. So they're significant patients in your clinic, but more importantly, we should be treating them better, I think. Okay, so future directions. We definitely need more research. We don't have class 1 studies to kind of validate all the things that we're recommending, but I think that we just need to do more studies than that. Multi-site, double-blinded, randomised, placebo-controlled studies. Okay, somebody's going to ask me this question. So I'm going to answer now, because you're all going to go, what do you think about stem cells? Okay, I have some stem cells in my clinic, not that I use them very often, but I was given them, and so I have them there. I don't think we have the answers. Ultimately, I think stem cell therapy is going to be the way of the future. There is no doubt, all the research that's happening, we're going to have some amazing options coming. But I don't think we have the answers to a lot of these questions yet, and for that reason, I find it hard to justify charging a client multiple thousands of dollars for something that I don't have scientific basis for yet. So, questions I think we need to answer. Where do we get the tissue from to make the stem cells? Do we get it from bone marrow, fat, skin? Do we get it embryonic? Do we get it from that patient or from another patient? I don't know. How many do we need? Is more better? I don't know. How do we actually isolate them and process them? Do we culture them? Do we just expand them in the ones that we have? How do we actually process them when we get them? I don't know if we know that. Do we give them into the site of the problem? Or do we just give them IV? Do they find their own way there? Do we give them a scaffold? You know, if we want to rebuild a meniscus, do we put some sort of scaffolding in there, inject stem cells and maybe a growth factor or something and grow our own cartilage again? Maybe, but I don't know yet. There's all these other kind of research being done on the platelet-rich plasma, PRPs, and various growth factors added to stem cells. I think that's a really exciting area, but again, we don't have enough information to say really what the right thing to do yet is. Anyway, so that's my take on stem cells. Yes, I think we're going to get there. I'm very happy if people are using it and you get good results. I think that may well be the case, but I just don't have enough evidence scientifically yet to say the right way to do it. Okay, I mentioned this yesterday and I've got a bit more time, I think, to mention it now. I'm kind of competitive, as you might have guessed, with skiing, and I kind of like the idea of having a Fitbit for my dog. So I saw this online not that long ago, and I decided to start bringing them into the country because I think Fitbikes are kind of cool. So you can actually attach this to the collar of your dog, and it measures bark points for your dog. So I have a pug cross, as I have already told you, on the right, and she, I'm pleased to say, is more active than 87% of all pugs in the world because she has 11,000 bark points per day, except maybe not at the moment because she's in hospital being boarded while I'm here. But yeah, she has this target. So you have the app on your phone that's free that you download, and it gives you this little chart and it tells you when they're sleeping, when they're active. It tells you how much time they do those things. It tells you whether you can actually put them on a chart against other dogs. So David Simpson's dog always beats mine because he lives on a farm and I live in like a little, inner city, small yard. So the only good thing I can say there is he forgets to charge his sometimes, so I do better. The charge lasts a couple of weeks, or a week and a half at least, and it's waterproof. And yeah, you can kind of just you can actually link your vet in. So the reason I got it, like I know I'm sounding like it's just a game, which it kind of is, but the reason I got it was that, say for osteoarthritis, if you want to manage that pet really well and you're relying just on the owner's feedback, that's not very, it's very subjective. But if you have one of these on the dog, you can actually monitor. So the dog at the moment can only make 2,000 bark points, say. You start treating it for osteoarthritis or weight loss. Just imagine what a great tool that would be to actually monitor that pet long term. So you'll be able to know, does that pet actually get to 5,000 bark points, or whatever it is. You'll be able to tell in a quantitative way how it's responding to the treatment. So I got them in because I actually wanted to measure post-operative care, and we're kind of just looking at how we can set up some research studies with that. But yeah, it's kind of cool. So if anybody's interested in asking me about this or wants one, I have them at the Hill stand today, so you can come and talk to me. This is my poster boy for metabolic. It's a bit embarrassing, isn't it? I can't believe I put him up there. Charlie, otherwise known as Sir Lunch-a-Lot, was 9.5 kilos. It's not my fault. He liked going to the 90-year-old person next door and eating from him. Anyway, he's now 6.5 kilos thanks to metabolic. And actually he has had lower urinary tract disease before, so metabolic plus urinary is perfect for him. So yeah, he doesn't look quite so elegant as the cat in the ad for it. I think he could be there though. Okay, summary. Recognise the potential for osteoarthritis in your patients. Diagnose it early, earlier the better. Educate your staff and clients on how to manage OA and obesity, and maybe look at how to improve compliance in your client education, okay? And recognise sometimes surgery is needed. Often surgery is needed. Let's get down to it. Surgery really fixes most things. So.